Hello, for those of you that don't know me, my name is Knox and I'm the Deputy Chief Executive here in Lanarkshire. This week I have been acting as Gold Commander and I've led our response to coronavirus or COVID-19. So the good news this week is that we are now beginning to see the numbers of COVID-19 patients decreasing, both in our ward areas but also in our intensive care facilities. And that's really good news for staff and also for our population. And I really hope the staff that have been nursing these patients, both in the ward areas and in critical care, do get a chance to get some rest and relaxation over the next few days and weeks. The other news is that we have been in the news. A BBC camera crew has been spending time at Wishaw Hospital looking at how the hospital has responded to COVID-19. As part of that response, they followed the story of baby Peyton. Baby Peyton was only 3 weeks old when she was diagnosed with COVID-19 and she was a baby within our maternity unit at Wishaw. I'm really pleased to say that baby Peyton has now gone home to be with her family and has been discharged from the hospital. This week has also seen the publication of COVID-19, a framework for decision making. This is a Scottish Government publication which begins to set out the way forward, both for our hospital and healthcare services, but for the population in general. It's clear that this virus is going to be with us for many months, and we need to think about how we live with the virus. Measures that have already been introduced, such as physical distancing and the hygiene measures that we all now take for granted, need to be reinforced and followed if we're going to contain the virus. But we need to think about how within healthcare delivery we're going to carry on delivering services not just for our COVID-19 patients but also those other patients who we know need our help and care. So we have to now start to think about how we plan to deliver healthcare for COVID patients and also our non-COVID patients, many of whom are now urgent and need treatment. So we'll be turning our thoughts to that over the next weeks and months. Many of you will be aware that sadly this week we lost a member of staff to COVID. Kirsty Jones was a valued member of staff and had worked in NHS Lanarkshire since the age of 17. Sadly, she was only 41 years old when she passed away and was the mother of 2 children. We send our condolences to the family and friends at this time. Clearly this is a difficult time for our staff and we would want to support our staff during this time. If resources are available, there is a 24-hour helpline for staff and the number for that is available both on First Port and it's also contained within our daily updates. Can I take this opportunity to thank all staff who work within NHS Lanarkshire for their continued commitment and hard work during this difficult time.